can see from this diagram, the prevalence of diabetes is higher among low-income individuals. But the prevalence within low-income individuals from quintile 1, there are a wide variation. And it's possible that maybe personality traits, perception of stress, and self-efficacy may buffer the risk of low socioeconomic status on diabetes. You can see from this table, regardless of disease duration, low SES individuals have higher numbers of rheumatoid arthritis. Socioeconomic status is also associated with systemic lupus erythematosus or SLE. And it's found that there's increased disease prevalence and severity among African Americans. And as we talked about earlier, different dimensions of inequality, race, income, age, sex, often interacts and intersects with one another. It is also found that lupus nephritis is more common among African Americans. And the researchers also found that low SES or poverty is associated with increased disease activity, organ damage, and risk of death. The researchers also found that low education is associated with increased disease activity, increased organ damage, decreased physical functioning, and increased mortality. As you can see from this older study, different dimensions of inequality, race, sex, education, income, interacts and intersects with one another. A higher number of women with high school education have cardiovascular disease during those times, from the 80s until in the early 80s. And the numbers are lower for men and women with less than high school education. This is probably due to maybe low education individuals are less likely to get treatment or get tested or get diagnosed for cardiovascular disease. And if you look at the lower panel of the same table, a higher number of medium-income individuals have cardiovascular disease. The numbers are lower among low-income individuals for the same reasons. These individuals may not have the opportunity or the resources, the means to get tested or to get diagnosed. This is a more recent studies that found a relationship between socioeconomic status and the risk of cardiovascular disease. According to this study, family history, diabetes, hypertension, obesity, sedentary lifestyle affects our dietary habits. This in turn affects our risk for cardiovascular disease. And this relationship differs across income levels, across educational levels, and across occupational groups. So the number of cardiovascular disease deaths varies by racial ethnic groups. And this says about the socioeconomic characteristics of these racial ethnic groups. The socioeconomic characteristics, socioeconomic well-being vary across racial ethnic groups. And these figures also say something about the level of social support that may vary across different racial ethnic groups. The level of social support at the family levels, at the community levels, may be higher for some ethnic groups than others. For instance, the presence of ethnic enclaves, Chinatown, Korean towns, in certain cities may serve as a buffer or a protective effect for cardiovascular disease for Asians. And the level of stress affects the likelihood of physiological dysregulation, and this relationship works through coping resources or the level of social support. Neighborhood factors like lead exposure, ambient air pollution can be detrimental to health. They can affect our cardiovascular functioning, or they can increase our risk for atherosclerosis, cardiovascular mortality, and asthma. And sometimes, living in certain neighborhood areas, suburbs, middle class neighborhoods, upper class neighborhoods, may be protective of these diseases or health conditions. Neighborhood factors can also interact with genetic factors to affect health outcomes. And according to the diathesis stress hypothesis, our predisposed biological or genetic vulnerability to disease or to health conditions, they can interact with environmental stresses, and these cause a multiplier effect on our susceptibility to psychiatric disorders. And the interaction between predisposed vulnerability and environmental stresses works through the short allele of serotonin transport genes in a person's system. So, researchers have found that individuals with the short allele of serotonin transport gene in their system tends to have higher susceptibility to psychiatric disorders because the multiplier effect is going to be greater.